I think there's a lot of opportunities to address some of the gaps. We've already identified how, as a company, we identified the gap in patient self-management empowerment and given the tools to manage the basic principles of asthma care from the comfort of their own home, 24/7 accessibility, so making healthcare more accessible to the patients. So we're already identifying that actually working in a more digitally enhanced fashion, we bring an additional um, opportunities, if you like, to asthma care going forward, whereby we've got empowered patient populations with their self-management tools, which clinical teams can use as well. So the apps as a self-management tool, brilliant. The patient have their access. They can utilize that to support their day-to-day management, but the clinical teams can also have access to a clinical dashboard through our apps, whereby they can use the apps in a supported self-management fashion, which then lends itself to remote management, but also to facilitate delivery of care. So things like we've seen during the pandemic, a lot of patients struggle to have some of their face-to-face reviews and things like inhaler technique, instruction, and education. That's covered in the app. So if you can get the patient registered onto the platform, which you can do remotely, then you can signpost the patient to their inhaler videos and they're getting 100% accurate demonstration of inhaler technique and not just shown once. They can watch it repeatedly. And to really drive up behavior change, we normally recommend that patients watch the videos once a day for the next 2 weeks, but pin it to their normal activity. So when they're taking their preventer inhalers in the morning, put the video on, take it with the video, and make sure that you're following all those steps so you get as much medication where it needs to be. So we're really optimizing and driving up sort of habitual use of the apps as well. So, feeding the app into the actual healthcare system, I think the app itself should be wrapped around the patient, if you like, and whether they're being seen in primary care, secondary care, community services, then the clinicians in those services, we can set up access so they would be able to say, okay, support self-management, these are the goals we're going to work on, and this is what I would like you to look at from, let's say, maybe acute. This is where we want to be focusing. So there's specific goals that are set along the touch point, but once that supported self-management, intervention is complete with the clinical service, the patient still reverts back to their self-management tool and the app remains there in the background, supporting them day to day. So it's about being an integral part of that integrated care system, and it's accessible by all levels of healthcare and really supporting the patient all the way through that journey.